This is a walkthrough of the Zenith E44 elevation chiropractic table. What we've got here is pretty much the Rolls Royce of elevation tables. This is my own personal table. This is a blue leather E44 with the optional wide cushions. And so these cushions here are about 21 inches wide as opposed to the standard 18 inches. You can actually have this cushion set here with a slightly smaller cutout here. We do have an infill blocker for that, but that can also be, that's the way this one here has been specified. And also with the wider pelvic section and the full single piece, not a split dorsal section. And we've got a head raiser, which means that this head piece can both tilt like this. And if I can do it, and sit there nice and level with the table. We can also angle the thoracic section up, and that would be somebody with a slightly more pronounced kyphosis or a big barrel chested chap. We've got the drop selectors, so this here is actually the tension on our drops. As we move one circle towards the lumbar drop, it increases the tension and decreases the tension on the thoracic. Really good for moving the drop selection and also changing the tension on the fly super quick. So that's now at maximum tension for the thoracic drop, minimum tension for the lumbar drop, and vice versa. Drop selector, so we've got a couple of options. We've got lumbo pelvic drop to drop together. Pelvic, as it was explained, just the pelvic drop. Lumbar is just the lumbar drop. Dorsal is these two cushions. We can isolate just for the thoracic drop by using this knob to turn the headpiece off. Dorsal and lumbar is all of these three drops together, and we're back to that lumbo pelvic. Now this has also got a directional drop, so this is not a Thompson move, but this is just any move. So if you've got somebody lying prone, you can have the drop and it will drop from superior to inferior when this knob here is in that direction. We activate the drops with a strip. We can change the drop direction, so now it's straight down, and then we do it again, and now the drop is going to be dropping along the line that lever points. And that's really good if somebody's got lying on their tummy and they've got a double AS, for example, or if they're lying on their tummy and the base of the sacrum is anterior, and it's causing lower back pain as it pinches on L5. What else can I show you? Oh, here you go. The elevation component of the pelvic section, great for pelvic tilt. We've got an adjustable ankle rest here that can lift up and lock. And we've also got the air strip on the ground. So this is what activates the drops. So it's the lumbo pelvic dropper up. Now we'll select the dorsal drop. Great. Good. Face paper holder. We don't always use ours. Sometimes we just use face paper tissue. And of course we've got the elevation button. So that's at maximum height there. And that gets up to about 26 inches. And it's going to lower all the way down. And the beauty of having it lowered all the way down is you can use the table for both side lying adjusting as well as the drop table adjusting. Or if you're wanting to do some supine cervical work, you can just sit in behind the headpiece and do your work that way. So anyway, that's the walk around for the E44. As I said, this is my personal table. I love it. I'm not going to be without it. If you've got any questions, please comment below.